Okay, this is E. So I'm going to talk about some researchers I found on potential pitfalls of implementing psychedelics-assisted psychotherapy. Before we talk about the medical systems in the US, I want to show some data I found about the diversity. Racial minority groups are very much underrepresented in psychedelic research. Michaels and his co-workers, they summarized 18 studies with 282 participants in psychedelic research and found that 82% of the participants to be non-Hispanic white. So similarly, in another research, they found 75% of all participants in the majority of psilocybin studies are white people. So I think PAP research should really adopt more cultural informed research design to incorporate racial minority groups of people into the research, the so-called evidence-based scientific research. So apart from the racial minority groups to be marginalized, other groups are also should be taken more consideration when psychedelics research are expanding. For example, both psilocybin and MDMA can increase blood pressure and heart rate. This can be a concern if used with older adults with cardiovascular disease. So research design regarding like different ages, different gender, different other traits of people with different maybe health issues should really be studied. So this is also tied to the scalability challenges or issues in the US medical system because psychedelics assisted therapy is very resource intensive. It takes a lot of time and energy to do the clinical trial. And a lot of people are worried like how economically viable this can be to the general public, especially those marginalized groups of people. For example, like whether public or private insurances, they're willing to cover those treatments if it is open to more people to use. Biber and Dyke in their research, they talk about some solutions such as use group psychedelic therapy and short-acting psychedelics. But they also raise the question like when psychedelic therapies should be offered in the course of a patient illness. So I do think like how the US medical system works is really tied to the application of PAP in the future. And this is also tied to the research. Something I want to say about the PAP research is that it's still in the early stage of research. So some researchers, they talk about that researchers and clinicians should remain neutral as they follow the scientific process, because a lot of times we have biases, especially there's a lot of like promotion or positive feedback from like media, but there's still more work to be done. And clinicians' own belief in PAP can be really important, and researchers as well. For example, the religious and spiritual beliefs and origins of psychedelics, which is related to like shamanism, how much you want to like include and introduce that to the research process versus the pursuit of evidence-based scientific research. I think people have different ideas into this part because some people say culturally this is something. Some people say, like, if we're doing clinical trials, we should be more serious, more like limited to the Western kind of medicine model. And this is also shown in this article I found about concerns and challenges in integration PAP. The clinicians, they raise different concerns, such as the cultural piece, right? Like how much the PAP research, they want to include the religious and spiritual origins versus the current Western medical paradigm, because they were worried that those traditions about ritual and substance, the psychoactive substances, will be lost or unappreciated. The participants, they also they worry about the commercialization of integration therapy, the misunderstandings of psychedelics as a sort of panacea, and apprehensions about power differentiations in the relationship between clients and therapists, and of course, the high cost and low availability of psychedelic treatment. So in terms of the safety and ethical issues, I think it's connected with the medical model and the current research. Johnson, he used the word psychedelic exceptionalism to describe this very unique position of psychedelic experiences, because it can be related to be very sacred. So he's afraid that some people will think that normal rules do not apply to psychedelics assisted therapy process. And he's afraid there may be a lack of boundary with clients. And he mentioned more like even the like sexual relationship a therapist may have with clients. We know like clients, they are extremely vulnerable under the use of psychedelics because the change of consciousness. So in those situations, how we can provide some guidance and not to explore it clients can be really important, also to provide that type of like safety to our clients. Some researchers also talk about the importance of documentations, such as informed consent. It should be like enhanced consent, meaning that we should provide more comprehensive educational information to the clients about the nature of the treatment, because this includes the acute intense change of consciousness. And another thing I think a lot of research talk about is the therapists and researchers' own personal use of psychedelics, and if how that impacts the research and the practice of PAP. As we know, the first wave of psychedelic research back into the 50s, 60s is closely tied to the researchers' own experience. And they've been like advocating because they knew this experience can be really great. And for the second wave, the renaissance of psychedelic research, is that also impacted if there's any relationship between the researchers for personal use and their research interest, because this can be a good value, right? Because they can have better understanding of the impact, but at the same time there's also people worry about objectivity of scientific research. This reminds me of self of the therapist work. I think if we practice PAP, this can be a really important thing. So some solution just in general, I think, is to develop guidance and training for psychedelic therapists. there may be more detailed guidelines in the future to address those safety and ethical issues. And those are my references. Thank you.